We're going to get into some principles and give you guys some general understanding of how the nervous system communicates and attaches to the body and vice versa. So you can actually use some of these ranges of motion. Because I don't even know, quite honestly, when the last time I even stretched before. Everything was all active.
Yep.
And if you know how to utilize certain aspects of your body, you won't necessarily need to go into stretching technique. It then turns into a kind of a mobility technique slash habitual pattern, kind of movement habit, if we will, on that.
And loading tissue.
Yes.
So we're going to talk a lot about
yes,
motor units, recruiting a lot of motor units, neurological input with that, what that does to the actual tissue itself. And just the other day, Dr. Jace was working on me. I had a wicked spasm. I think I had a rib out, all the other fun things that can happen. And most of what I was doing was loading my tissue. I had a really tight trap area. So I was lifting heavy things and I was putting isometric holds on that area, and I was just trying to engage as much information to that area as possible, along with getting adjusted, which helped immensely. But a lot of that started to reduce the tension in that area. I wasn't doing this and trying to get it to a certain way. But I wish more people knew about how to more effectively manage something like that
100%.
Without getting just stuck in this state of pain forever and not getting any outcomes. Yeah, we're excited to bring to you guys some tools, some value that I think might change your way of thinking and definitely will promote way more outcomes than you realize. Let's get into this. So
beautiful.
Let's first start with why this matters. So what are some, we'll call it false claims or even misconceptions around flexibility, and you want to just bring them through, let's just call it things that we've maybe thought about in the past and why we need to change the way we think now, just regarding the misinterpretation of stretching and those kinds of things.
Absolutely. So let's start with some of the main basics. So when you look at and understand that your body is trying to conserve energy, just naturally, it's what it's built to do. When you're not able to go into certain ranges of motion, when you're not utilizing the ability of your body to go and open up and move fully, honestly, that's where your body's going to conserve that energy and it's going to restrict. That's going to be via signal of your nervous system, brain to tissues, to increase range of motion, to feel like you have the flexibility, that a lack of stiffness. A lot of that is a guarding mechanism of the body. And if your body feels like it's not safe or if it's unfamiliar to move in these different areas, it's going to be constricted for longer periods of time, which can last decades long from there. So
for sure,
when you look at the flexibility and the ability to move, a lot of it is communication through the nervous system back and forth. So there's certain things known as passive range of motion, where someone moves your arm or someone moves yourself without your control. And that's where you can see, so for example, for the people that are not watching this, let's think about the shoulder. If someone else is assessing you, whether it's a practitioner, friend, family member, doesn't matter too much, they hold the forearm and they're moving your body, your arm, through the biggest circle you possibly can. If you remember workspace or controlled articular rotation cars, you'll have a general understanding. You're going to notice that there's a difference between someone else moving that limb, passive range of motion, and active range of motion, where actively you're controlling it, you're moving your arm through the biggest circle. And there's a difference between passive and active. Almost always, I can't think of a time to where it hasn't been. Passive range of motion is going to be, you're going to be able to move there at the most. And you're trying to almost shrink that gap between what you're actively able to control and what is physically possible. So that's where you can get into what are the limitations, what are some of the things that can be a barrier for that. And a lot of that comes back to the joint space in the body itself, because the joints are going to be the first signalers to the brain, to where if there's any problem in any joint, it's going to send a signal to the spinal cord, straight up to the brain, no delay. Where some of the overlying muscle tissues and tension go to the spinal cord, slight delay at an inner neuron, and then kick back up to the brain. So if there's a problem at the joint, it's already going to send that signal up to the brain and back before the overlying tissues, which if you rehab and look at on how you can improve your flexibility, improve your range of motion, you have to start at the joint level first
100%.
because of that signal. Now, to increase and bring that difference from your active range of motion to your passive range of motion, that involves your nervous system ramping up or controlling like a contraction, which we'll get into certain tactics here in a sec on how to do some of that. But that's the premise of the communication to the body and brain, starting at a joint level, and then from there you have to ramp up the nervous system to tell the brain to the body to be able, okay, it's safe to move in this area, in this range of motion. We're going to release the muscle guarding. And the muscle guarding, taking a side look at this, it can come from injuries, whether it's a motor vehicle accident, whether it's a fall when you're like at a kid early in life,
Yep.
whether it's you haven't used this, your arm or this body part forever, for decades long, and now you're having compensations above or below that area. Let's say for lower back, you're having knee problems, foot problems, shoulder problems. But if your lower back's not able to move, all these other areas are compensating because of lack of movement in one area. So then you start at the joint level first. You open up that range of motion. You create that connection between brain and tissues. Also at the same time removing and reducing all these other compensations above and below, and it can open up from there. So there's a few different principles. Once you have a general understanding of where you need to go and the reason why you're not flexible, there's a lot of different small variables in place from there.
I just literally heard Galpin talk about this on his podcast the other day, and he explained it as motor units. So
Yes.
if we were going to lift a feather, he goes, your body is going to try to use as minimal amount, he liked to use the words minimal amount of motor units as possible. Back to your conservation of energy theory,
Yes.
which is so, I think that helped me understand a lot more.
Yep.
And he goes, okay, now you're going to go pick up a couch. He goes, guess what? Your body doesn't switch it and gives you the maximum. It's still the same. It gives you the minimum. It's trying to give you the minimum amount of motor units to complete that task.
Yes.
And so when you understand that, it's now a war. You're trying to gain as much motor unit involvement via the brain as possible.
Yes.
How do you do that? How do you continue to ask for more involvement of motor? How do you train that? How do you approach that? And that, to me, I think made a lot more sense to how I could explain it to the patient. Why am I not able to move this way? Have you asked for it?
Love how you said that.
Have you actually tried to recruit more motor units? Because you just trying to move it one way, you don't have the neural control. There's no capsule integrity movement. There's no function. There's no, like, you completely take away all the things that would increase and gain more motor unit control. Just simple range of motion doesn't break down the neuromuscular component, doesn't really cause contraction. All these other things that are needed for more information and messaging to that area. And I like the way you said the conservation of energy, because I think that makes a lot of sense when we're trying to explain this to patients.
Yeah, it follows a lot of the rules of the universe. And I love the comment that you brought up with that, because I think explaining it in a couple different ways will get your mind thinking of it's not as simple as people think.
No.
So when you're looking at, and let's break apart from this way of like standard like training, like workout training of, let's say, am I working my bis and tris, my bicep and tricep today? Am I working my arms? Well, it's a little different than that. So going back to the motor units, especially with Dr. Addy Galpin, let's say if you would look at the image of cutting your arm in half, obviously it's a terrible image, but if you can think about the muscles that would face you if you're cutting your arm, and you can see that there's different parts of the muscle belly. Now, in terms of motor units from the nervous system to the tissues, if you are going through repetitive movements, let's say bicep curl or skull crushers with tricep extension, you're going to only utilize certain motor units in that specific spot of the muscle belly. And then you have to think, okay, it's not just a bicep. Each muscle, each bicep has a bunch of different motor units and a bunch of different layers and bundles and fascicles within it. And that goes into, when people think about fascia, and we're going to get into this in a later part, to where the epimysium is the outer layer between different larger muscle groups, and then it goes and separates into perimysium and then epimysium, or excuse me, endomysium. So there's different layers of fascia, and then more or less each muscle falls along the same pathway as the sliding filament theory, to where when actin myosin contract and relax, the part that they don't talk about is that they also permeate laterally. So there's like a rotational component, because you're looking at and thinking about a 2D structure versus a 3D structure. So knowing the different layers of muscle tissue, knowing that the motor units attach to different fascicles, which is deep portion part of one part of this muscle belly, and if you're activating one of these parts of the motor units, you're not activating a different part that doesn't have a stretch reflex. You're not activating over here. What are you training? If you go through this repetitive cycles, you're recruiting the same motor unit you've been recruiting all along. Unless you change the angle, unless you change the direction, the parameter, and how you load those tissues, you're not going to adapt those other motor units. Which then goes into the next part, that if your muscles outworked your connective tissue, i.e. ligaments, tendons, those will yield, the soft tissue, connective tissue will yield due to injury. There's the tendonitis.
Yeah.
There's the other injuries of, let's say, for lower back, for example, I bent down and my back gave out. You probably didn't have the musculature, the connective tissue to hold everything in place. And that's where you see shifting of certain ligaments and laxicity of the spine, then discs come out.
Yeah.
There's injuries to the shoulders, like any other part of the body, because any injury is almost like a mathematical equation, to where you're not either able to absorb or move into one direction if you haven't trained it. If so, if certain tissues aren't able to absorb that force against gravity or that direction, they give out. So that goes into the specificity of training, but train all the motor units, train as much of the muscle belly as you possibly can, not only locally, but whole systemically wide as well.
And I think you might have to go back and watch that again, because there was a lot of information there. But
Points.
I do think trying to understand that is going to change how you train. It's going to change how you try to help out an ache and a pain from your day-to-day life. And it should hopefully get you to understand that if you have practitioners or providers who don't understand that yet, you're going to be given just such a different protocol than what Dr. Jace gives patients and what we work on in the gym, and all the ways that we train our bodies differently. And we're going to talk about what that looks like, but just your simple this stretch, go and do this and this that you might get from all your providers, PT, what have you, that isn't even level 1. That's like level 0.5, 0.3. And we're not even scratching the surface on directly improving you using these kinds of mechanisms anymore. So there's just so much more that's needed